Let me start the proceedings here.
Okay.
Okay. So, welcome everyone. We will start as we normally do with a little round of introductions through everyone. And let me see. The first thing is I'll get all the participants on the side here. Okay. So, I'm just going to run down through the list as I see everyone here. And if you could just take a moment and introduce yourself, where you're coming from, and what your interests are, we'd really appreciate it. Okay, so I see the first name here is Andrew Swift.
Hello, I'm Andrew. I'm a sociology doctoral student at the University of Chicago, interested in disaster governance. So that's what brings me here.
Okay, thank you. Dave Christensen.
Hello, I'm a member of CCRM for quite a few years as a practitioner primarily, working in high reliability organizing with wildland firefighting incident management teams, and then more recently working with utility companies on their efforts to embed psychological safety and bring about high reliability. So it's really a great group. Glad to be invited. Thank you.
Great, thank you. Ellen.
Hi, I'm Ellen Boucher. I'm new here. I teach history at Amherst College, and I have a fellowship to come to Berkeley next year, starting in August. So I study risk as it applies to sort of the cultivation of a neoliberal sensibility in the 19th and 20th centuries in Britain.
Sounds interesting. Welcome. Okay, Gudveig.
Hello, I'm also new here. My name is Gudveig Jøsund. I work at NTNU Social Research in Trondheim. And I think some of you know Stian Antonsen. I work with him and he tipped me off about this seminar. I usually work with societal safety and public health. And now these days I work a lot with Stian on a project called Corner, where we look at how the pandemic is handled at all levels in Norway and Sweden and Italy.
All right, welcome. Thank you.
Thank you.
Howard.
All right, can you hear me now?
Yes.
Okay, very. Howard Foster, researcher with CCRM, specializing in GIS and the visualization of geographic phenomena.
Thanks, good to see you, Howard. Ian.
Ian Mitroff, I'm a researcher with CCRM. I'm one of the principal founders, I like to think, of crisis management, and I work on complex, messy systems.
John Carroll.
Hi, John Carroll at MIT Sloan School, work in Organization Studies Group. Long-standing interest in safety and how people think about safety.
Thank you. Kathy.
Hi, I'm Kathy Schaefer. I'm working on the interest of flood insurance, and so I'm really interested to see how I might be able to substitute the words flood for pandemic in your presentation. So thank you.
Thanks. Natalia.
Hi, everyone. My name is Natalia Smaluk. I'm based in Toronto. My background is in crisis communications. I own a consulting firm helping organizations navigate different scenarios of change and crisis. And I'm interested in how to build resilient organizations.
Thank you. Ranga.
Hi, can you hear me okay? Yep.
Yes.
It's Ranga. I'm at Vanderbilt University. I teach at the business school. I have interest in organizational errors as well as high reliability, especially in the context of healthcare. And I'm really looking forward to this presentation. And I want to apologize in advance. I have a hard stop 90 minutes past the hour, so 1:30 local time. Just want to give a heads up. Thanks.
Thanks, Ranga. Renaud.
Hi, I'm Renaud Vidal, researcher in HRL and a former visiting scholar at CCRM.
Good to hear you, Renaud. Let's see. Rune, are you there? Do you want to introduce yourself? I don't know if he's able to, but okay, perhaps not. So Rune is the executive director of CCRM and does the yeoman's work to organize meetings for CCRM. Stian.
Hi, my name is Stian. I met some of you before. I'm a researcher based in Trondheim, Norway. Currently leading a project on adaptive capacity on pandemic management in Norway right now.
All right. Welcome back. Terry.
Hi, Terry Hill. I'm a local physician here in California, working the last year mostly with my local health department on managing COVID, particularly around long-term care facilities and doing research.
Good to see you, Terry. And Tona.
Hi everyone, I'm Tone Slottsvik. I'm a PhD candidate at the University of Stavanger in Norway, and I study the effects of competitive outsourcing on the reliability of critical services. And I'm very happy to be here, very interested to hear the presentation.
Welcome, very interesting. Thank you to all. My name is Peter Martelli. I'm the co-director of CCRM, and I am an associate professor of healthcare management at Suffolk University in Boston. So before we begin, some background on our center. The Center for Catastrophic Risk Management was founded in 2005 in the wake of Hurricane Katrina. We are a global group of applied researchers from academia, government, and industry who have come together to develop pragmatic solutions for the complex, multi-jurisdictional, messy problems of the 21st century. We conduct fundamental research on catastrophic risk through empirical data. By identifying and engaging targeted teams whose expertise are uniquely tailored to each challenge, CCRM aims to help make the intractable manageable. And today we have a fantastic presentation by two of our home team, Paul Schulman and Emery Roe, both senior research associates. Paul is an emeritus professor of government at Mills College in Oakland. He's written extensively on managing hazardous technical systems to high levels of reliability and safety within organizations and across networks of organizations. His books include Reliability and Risk and High Reliability Management, both with Emery, and large-scale policymaking. And he's been a consultant to many places, including the Canadian Nuclear Safety Commission, CAL-ISO, Lawrence Livermore Labs, and elsewhere. Emery Roe is a senior research associate. He has been a practicing policy analyst and has authored many articles and publications, including the two books with Paul, that's Reliability and Risk and High Reliability Management, and Making the Most of Mess and Narrative Policy Analysis. You can read his fascinating posts at his blog, When Complex is as Simple as It Gets, and the link to the blog went out with the invitation. You can also find it online. So with that, let me turn it over to Paul, who I think you're controlling the slides now, Paul.
Can you see me? Can you see the slides?
I can't see you, but I can see the slides.
Yeah, okay. You don't need to see me then. That's good. Whoops, excuse me, just a little. There, how's that? Can you see the big slide?
No, just the normal view. Well,
oh, really? That's interesting.
It's
Okay.
interrupted by the bar of options.
Yeah, you could collapse the bar. That would give a little more space, and I think it should be fine.
Okay, let me, this is a little more complicated because I have to get out of this thing here. Let's see how I do this. Does this get rid of it? No. Okay, I'll tell you what. why don't you share your screen, and I'll stop sharing my screen.
Okay, and then we'll be able to see you as well.
Yeah.
Okay. So let me
So
take.
I'm not sharing anymore.
Okay.
And,
like I
you
said, Teams is a very interesting system. Okay. So, can you see this now?
Yeah, that's just what I had. Okay.
And
yeah, right.
Is this,
okay. There,
is this
that's
better?
it. Yeah. That's it.
Okay. So just before we start, let me tell everyone that we're recording the presentation, but typically we don't record the discussion. All right. So take it away, Paul.
Thanks. Well, welcome everybody, and thank you for coming. I think, like many of you, probably most people, we have been following various twists and turns in the COVID-19 pandemic, and our interests. It's almost impossible for Emery and I not to look at what's happening with respect to the pandemic through the lens of our experience with looking at high reliability organizations. And so this is going to be a learning by opposites. We're going to try to present some of the features that we have seen in high reliability organizations and their high reliability management, and look at those performance standards which have evolved to assess these organizations, and look at those in relationship to COVID. And what we find is a very, very different domain and a very different problem. And so what we want to do is to highlight, not to judge that problem. If you can go to the first page, that would be good. Not to judge the problem, but to talk about how we can even try to assess and understand the performance of it. So that's the lens through which we're going to use. To start with, obviously, we would argue it's probably the seminal international event so far of the 21st century. And the 3.8 million deaths have been reported, and 7.1 million estimated. It's been projected that the worldwide economic cost is somewhere around 6.6% of world GDP in 2020, relative to what the GDP output would have been without the pandemic. First thing to note, estimates like these are themselves reflections of the uncertainties and information surrounding the epidemic. No one believes that the 3.8 million reported deaths are actually an accurate number. And the estimations are simply estimations with various arguments about whether they're accurate and how to do them. What we assert with more confidence than any of the statistics that we've cited is that the pandemic basically has obviously posed what we consider a unique challenge worldwide to the capacity of public health organizations and a variety of social regulatory agencies to basically cope with. Not only their policy making processes, but their regulatory capacities and management processes. Next slide, if you can. So we have some starting assumptions. Again, we're not interested in assigning blame for poor performance in public health management and policy relative to the COVID-19 pandemic. And we're going to be trying to convince you that you shouldn't be that interested in it either, yet. What we're interested in is exploring what performance we can reasonably expect against special properties of the pandemic, and maybe some other problems which might emerge with similar properties. And again, we're going to use the high reliability contrasting process to highlight these. Next slide, please. So we have come to the conclusion that we really need to think through, in light of the COVID situation, the applicability of concepts that we've used, like reliability, effectiveness, resilience, even error, and accountability in relationship to this particular pandemic and its management and policy. And again, we propose suspending their use as performance standards while we do this thinking. At least let's suspend it for the time that we're going to be in this session, and hopefully we can be arguers for suspending it for far longer. We want to do that before these are used as standards of assessment, condemnation, and accountability. Next slide, please. So our question is, what do reliability, effectiveness, resilience, error, and accountability mean for assessing the performance of policymaking and management in the face of a public problem like the COVID-19 pandemic that is at once fourfold in its challenge with respect to these four variables that we're going to describe? They are at the COVID-19 is at the extreme for all four of these variables. First, complexity. A tremendous number of tightly connected variables are in play across policy domains of not only healthcare and public health, but medical research, law enforcement, economic regulation, education, and of course, a whole variety of individual behaviors. Uncertainty. There have been many unknowns, strategically important unknowns. First, in the transmissibility of the initial virus, and still its evolving variants. Treatment, tremendous uncertainties in treatments initially, and it's been argued that there were many deaths, unfortunately, because of errors made in those initial treatments and uses of ventilators. Long-term disease effects, still uncertain. Initial and long-term effectiveness. The initial vaccine effectiveness tests were done with very small samples, unusually small samples relative to normally testing a vaccine. And we still don't know anything about the long-term effectiveness of the current messenger RNA vaccines. Vaccination and lockdown compliance rates. We've been surprised and uncertain about what those rates would be. The accuracy, as I've already indicated, of exposure, case, and death rates. We have, in this country especially, had very little reliable information on exposure rates. And in other countries, we have very little reliable information on death rates and case rates in all countries. Those cases that do not have dramatic symptoms, we don't know and have accurate counts on. Also, uncertainty and surprises in surges. Next slide, please. Fast moving. The propagation of cases and surges in cases has been incredibly fast, and so is the spread of variants. Within weeks of the identification of the UK variant in California, it already was accounting for something like 20 or 30% of the cases. Initially, tremendously rapid growth in public demands in this country, especially for masks, hand sanitizers that well outstripped production capacity. Toilet paper became one of the most sought after commodities in the country, for example. Rapid ramification from pandemic policy and management decisions to other domains. It was a very short stretch from the initial public health lockdowns to the economic recession and growth in unemployment rates, certainly in this country. We have been fast, historically fast in developing these new vaccines, the mRNA, the messenger RNA viruses that represent tremendous breakthroughs in medicine. However, they were not fast enough relative to the spread of the virus, that's for sure. So speed is really a major feature. And then lastly, the large and global scale of the problem. The ability of the virus to be transmitted across nations, the international travel restrictions that had to be implemented, the global economic effects that still occur from national lockdowns, for example, on other countries throughout the world. Next slide, please. Factors like these at their extremes lead to what Danny Kahneman and what's his name, Klein, I forget his first name, how can I do that? Senior moment. Anyway, have called environments of low validity. They challenge, in their view, rational decision-making through rapid and turbulent change, unreliable information concerning conditions and events, and information and experience that become very weak predictors of future trends and events. Next, please. By the way, are you getting this? You're moving along as I'm talking. Can you hear me? Hello?
Yes, yes.
Oh, okay, okay, good. So as we hope to demonstrate, these features of COVID-19 as a public problem, its complexity, uncertainty, speed, and large and global scale, mean thousands of deaths are an inevitable consequence of the disease itself, irrespective of any policy and managerial process applied to it. Now, you may think, well, that's ridiculous. How can you say something like that? Well, there are a number of studies that have been looking at variations in death rates. And one of them that's interesting, I just saw recently, is from a journal called Infection, great title for a journal. Their conclusion, COVID-19 death is found not significantly correlated with a country's stringency index, which means it records the strictness of lockdown style policies and policies that primarily restrict people's behavior. Not significantly correlated with that, the death rate per million. It's not significantly correlated with, they say, population density, virus tests, extreme poverty rates, hospital bed availability, and other factors. So those stringency index variables are the main variables of policymaking and management with respect to the pandemic. So I think we have to recognize that when a problem like the COVID pandemic has these properties, it raises enormous challenges to the ability of policy and managerial processes applied to it to be successful with respect to the ability to control the death rate. And later on, I'm going to raise also the issue. A number of studies have found, in fact, one major study at Northwestern found that none of the variables they looked at in terms of mortality rates, which included doctors per 1,000 people, size of average household, et cetera. As it turned out, none of these variables emerged as good predictors of COVID deaths, but another variable did. A country's level of pre-COVID income inequality was by far the best predictor of variations in the COVID death rate. The same findings emerged when the researchers studied variations in COVID death rates across US states. That variable inequality, I would have to say, is also out of the reach of policy-making organizations that are related to the COVID-19 pandemic. So in our sense, to label the COVID-19 pandemic simply as a crisis or even a super crisis misses the logically and empirically prior problem of these four features and their implications for our ability to even assess performance in policy and management of a problem with the features of COVID-19. Next slide, please. Let's explore these properties more carefully in relation to what we've seen in the high reliability organizations and their management in the research that Emery and I have done and others too. First, reliability. There are, for HROs and for HRM type organizations, clear performance standards for what reliability means. They are understood and agreed upon in both processes and their application to outputs. Todd Laporte has offered a very nice, it seems to me, definition of the general understanding of what reliability is as a variable. It's the continuous provision of service and safety of core activities and processes in organizations. Because failure in operating processes can result in major, if not catastrophic, accidents. And by the way, the dread of those accidents has been a major feature in the ability of high reliability organizations to evolve and persist. Failure in output is also an obvious lapse in the provision of a critical service, and reliability in output is essential. Reliability is well defined for these organizations at the design and the operational level as a standard in precluding these failures from happening. We call this, in fact, precluded event reliability, which is the standard that applies in these organizations that we've looked at. It goes without saying that this is a rarity among organizations. This is not typical in public or even private organizations. Many of them would fail to meet these or even accept these standards. And in fact, for public organizations, there would be very little public tolerance for the expense required of using reliability as the major criteria for organizing and conducting operations. Next slide, please. Same thing for effectiveness. Effectiveness refers to the ability of an organization or policy to achieve the objective it intends to produce. In the context of high reliability organizations, the objectives, safe service and continuous service, are clear, and the means to achieve them are well understood. The technologies used by high reliability organizations are mature technologies, well understood. By the way, continuous improvement in reliability is also typically an objective of these organizations. There are formal measures connected with this effectiveness, which allow comparative assessments across other organizations or the same organization in different timeframes. As with reliability, many conventional organizations adopt a multiplicity of objectives or have them imposed on them, and some of these may well conflict, making effectiveness at times a problematic concept. Next slide, please. Resilience. Let's take resilience. That's often taken now to be a very positive assessment variable to use with respect to organizations. It's typically defined in terms of bounce back from failure. But resilience is less an ongoing property of an organization to be assessed than processes that are underway that have been demonstrated. As Eric Holnagel has said, it's far harder to say an organization is resilient than to say that it was resilient. For HROs, the failure bounce back dimension of resilience is much less prominent, since most consequential failures are precluded events that the organization is key to prevent at nearly all costs. There is a form of resilience practice in HROs, which Emery and I have seen and written about in some detail. We call it Precursor Resilience. Operations and performance within these organizations is kept within a bandwidth of what are called acceptable conditions. Elaborate studies have been done to try to trace accidents back to various kinds of precursor conditions or events. And these organizations are very sensitive to keeping themselves out of these precursor conditions. When those conditions stray toward the edges of permissible bandwidths, rapid recognition and correction occurs. Anybody around in the organization can report conditions. In fact, there is language in these organizations to highlight their stray toward the edges of entering a precursor zone. One of them is, I'm not comfortable with current conditions. Or another is, I find myself in unstudied conditions. When those, in fact, in America, it's illegal to operate a nuclear power plant outside of analysis. Those types of words have tremendous weight in an organization that's devoted to high reliability. And its ability to correct and restore or even suspend operations when they haven't been able to get out of precursor conditions has been a major property of these organizations. That's the resilience that they feature. Next slide, please. Now let's talk a little about error. We use error as an evaluator. This is riddled with errors. Errors are being made all over the place here. Within HROs, error has a very different meaning. It's often formally identifiable in the context of models of causation and operation that underlie, quote, rules of rightness. Those rules of rightness define appropriate tasks and their expected outcomes. Given that the technologies in HROs are mature and well understood, as well as the prominence of formal modeling and long experience in these underlying these operations, error is recognizable relatively quickly. In other organizations, what constitutes an error may be ambiguous, in dispute, or not revealed for long periods of time, retrospectively only. As one organizational executive commented once, the more important the decision, the less precise the tools we have to analyze it, and the longer it will take before we know if we were right. Next slide, please. Because error is more clearly definable and recognizable in an HRO, accountability can also be more clearly applied and formalized. Accountability can be more accurately assessed because it can be tied to identifiable errors and not imposed generally as part of the social condemnation of undesired outputs and outcomes. For many organizations and many policy areas, basically accountability is equivalent to taking a scythe into a wheat field. So for our purposes today, what are the major implications of HROs having these properties? And what are the implications in relation to COVID? Next slide, please. One implication is it's important to recognize that uncertainty is not unbounded in HROs. Some analysts, I know there's a lot of romance now with the idea of deep uncertainty and all the unknown unknowns, and basically there's a pessimism that we can't keep catastrophes from happening because we don't even know what we don't know. And that uncertainty, we can't define the boundaries. You don't even know its specific threats. All you know is catastrophes are around the corner. Well, uncertainties are differently treated in HROs. Uncertainty itself is differentiated, it's specified, it's categorized in HROs. The Nuclear Regulatory Commission identifies things like parametric uncertainty, modeling uncertainty, incompleteness uncertainty. Those are they try to identify those types of uncertainty and their relationship to error. HROs demonstrate in their operations that epistemic uncertainty need not be synonymous with unknown unknowns. It may be contained in known unknowns. Yes, there are aleatory uncertainties in engineering. There are other known unknowns, and they can be managed reliably through precursor strategies. One of the things Kenneth Pedersen and Kenneth has talked about a lot is the search for unknown knowns. High reliability organizations spend a lot of time looking for unknown. Does somebody else know about something that we don't? And in fact, the accident literature indicates that for many of the accidents that happened, specific conditions and risks and likelihoods were known by somebody, but nobody paid attention. So this is the kind of uncertainty that HROs can cope with and manage. This kind of uncertainty management and the other features hardly apply at all to the challenges of managing something like the COVID epidemic. Next slide, please. So first, we want to say that in looking at the contrast, we don't want to draw with too broad a brush. There obviously are certain features of the effort to manage the pandemic that might be more like HROs than like the extreme invalid environments that Kahneman and Tversky were talking about. And arguably, I think vaccination programs are one of those you can use. The fact is, people know how to give vaccines. They have long experience, so the reliability could be applied, I think, to the giving of vaccines and the strategies for scaling up the giving of vaccines, because there is information and it is a known process. Let's go further. Next slide, please. we have to recognize that aside from those reducible features of COVID-19 management, the standards, reliability, effectiveness, resilience, error, and accountability generally are inadequate to describe the challenges of those problem characteristics for COVID-19. And we would argue, including emergency and crisis management. For us, this conclusion means that with respect to performance problems identified with the COVID, the following are maybe priorities for attention. Think about learning and adaptation. Well, learning and adaptation, which we think of as important, are also going to be difficult against moving and changeable targets, such as the proliferation and propagation of the variants. But there are other things equally difficult to be learned about and adapted to. The connection of these interdependencies. One of the things, first off, we are incredibly interdependent, but one of the things that Emery and I have noticed that's interesting about interdependencies, there are latent interdependencies that are not seen until there are crisis situations or difficulties. Gee, I didn't even know that if I did this, it was going to affect that.
Peter, can you shift to the next slide? Yeah, good.
Okay, let's go to the next slide because we're running out of time here. Okay, so what are our provisional conclusions? Those of us, and that includes all of the people I believe in this group, who have specialized in the study of organizations and policy, should take the lead in rethinking the standards appropriate to assess performance in the face of problems such as COVID-19. Perhaps policy and management directed to this and potentially other emerging problems of this character, such as terrorism and climate change, will have to resemble ongoing R&D projects more than stable and institutionalized policy undertakings and management processes. Here, learning by trial without condemnation of error or failure and managing the unexpected may well be foundational strategies necessary for progress and should be accepted as such. But in any case, it's our argument here that it's of tremendous importance, growing importance, to protect against premature and misleading performance judgments that are based on standards that don't have justifiable application. That is its own recipe for error and misdirection. Thanks. I'm finally done. Hello.
Okay. Yes, there's multiple screens there. So I'm just going to go back to slide 17 for a moment because it wasn't on screen for very long. So these are the priorities for focus and attention. So
yes.
Yeah, one of them that's, I think, important is the third bullet there. Weakness and flaws in other policies and practices in relation to things like equality, fairness, and just treatment become highlighted in connection with a problem like, particularly like the COVID-19. Then, because you can see a correlation between some of these inequalities and death rates, they become significant. But remember, you can't, a COVID strategy can't be a theory of everything. And the COVID agencies can't be agencies of everything. So it becomes extremely difficult. The control variables available for COVID-19 and other pandemic management do not include the ability to shape and direct those factors.
Okay. So let's see if I can stop sharing. All right. So do we all see each other again? Yeah. Okay. All right. Well, thank you very much, Paul and Emery, for another fascinating presentation. I'll just start with one question. So I guess one or both of you wrote a piece several years ago on pandemics, and I remember coming across it in my files, and so I emailed you like, boy, this seems rather prescient, you know. What can you critique of your own thinking from that time? Do you find that there were areas where you over or underestimated or anything that you would sort of change from that initial take on the pandemic situation?
Well, let me start with that because I think you're referring to something I wrote. Let's make it real. There was in foreign policy, there was a famous series in 2005 called The Coming Pandemic. That's where I started thinking about it. And the people who wrote the major articles in 2005 are still with us today. And they have been trying to compare what they didn't get and what they did get. And what you would be very hard put is to see that in their 2005, they were prescient about a new pandemic coming, but they were not prescient about not just the details, but they were not prescient about how hard it is going to be prepare for the next pandemic. If this pandemic is really a function of broader system problems, and let me start with, I've been making a list of the pandemic has been blamed on primarily climate change, the international political order, neoliberalism, poverty, inequality, global and local injustice, biodiversity loss, and species extinction, just to begin with that list. It's hard to understand what actually we are supposed to be preparing for. And to get back to Paul's original point, who amongst us would say that we would have to solve those problems, ameliorate those problems, manage those problems better? So I think what I've learned out of this exercise is that part of what needs to be done is to start by saying what of the COVID-19 pandemic is less complex, less uncertain, less propagative, less global, or what parts are HR, high reliability, what parts are already R&D in ways that we would like to see more R&D, and start parsing those out, because we can in fact begin to focus on those. But believe me, that will be 0.001% of the COVID problem, because as long as people really believe that it is a function of these macro forces at work. My prediction, though, is that were we to parse out what is doable from that list, even if it is 0.001, you will find that the effect of racism, imperialism, nationalism, the neoliberal order, the geopolitics will be constellated differently from site to site. That there is no primus inter pares among all those huge forces. It is basically the fact that they're differently constellated by different sites. And policy will have to recognize that. But we're no near recognizing particularity or the differentiations that are needed with COVID right now.
Thanks. Stian, your hand.
Thanks for a really, I think this was a thought-provoking presentation. I'm just wondering about the implication of your four sort of features: the complexity, uncertainty, the speed, and the scale. Perhaps you can add one more, and implicating that it might be beyond management and might be beyond policy. I'm thinking of the need you have to sort of have the legitimacy in measures and have citizens on board, because many of us, we are the ones doing the measures, social distancing and sort of basic hygiene and whatever. But I'm wondering, with these four traits together, does this mean that this might be a mutation of mess that can't be managed?
Well, I think I would just say, with respect to the public's perceptions, I think the capacity, if I had to outline sort of what does it mean, what are the elements and variables of capacity of organizations to solve problems, there are many dimensions, or three in particular: the nature of the mission and the mission objectives. What are those objectives like? What's their urgency and what's the scope of them? The character of the problem in pursuing the objective, the variables, the four variables we just talked about today, but also the context of those objectives. And one of those is public and political support for the objective, and the public psychology with respect to costs and risks. And so let's just take the COVID. Unfortunately, I suppose in our country, the precursor to the COVID has been annual flus. Well, in this data that's been compiled about annual flu deaths, we range from 12,000 to 50,000 deaths a year annually from flu. We never do a lockdown. There's no social distancing, there's no mask wearing, etc. Those, and rarely do 50% of the public even bother to take the vaccine, a vaccine. So that's a different risk. The public doesn't care about those. Same thing, that's just background noise. Same thing with respect to automobile, that we kill 35 to 40,000 people a year in automobile accidents. That's just background. Nobody pays any attention to that. But if you kill 300 people in a commercial aircraft, that's significant. People worry about, we got to have more regulation of safety in airlines, for example. And anything to do with nuclear power that's why we have HROs in the area of nuclear power plants and nuclear power. That psychology is huge. And I don't, how do you get this? I know in, areas, I used to get invited, believe it or not, to healthcare conferences. They wanted to be like HROs. They wanted to be they talked about, we want zero accidents. We want to look like aviation. And I tried to point, well, it's a different, you're not the same as nuclear power plant. Finally, in one of the conferences, I said, okay, here's where you'd have to start if you want to be as reliable as an HRO. You have to tell people that when they go into a medical center, it's out to kill them. Strangely enough, that's the last time I was ever invited to a healthcare conference. But in a sense, I think you're right. The context and the public perceptions, willingness to bear the costs, the dread, the prospective dread, as opposed to retrospective condemnation, that has to be there. I don't know how you get that.
Terry, I'm curious as to your experience in, is it Alameda County or Contra Costa? Where were you working? Like just what people thought and how to manage that both from the top down and the bottom up.
Yeah, just briefly. I mean, this is helpful in reminding me, and Paul, I think your last comments, pretty much nailed it. We tolerate a level of lack of preparedness and poor management that is really amazing. And so, yes, to Emery's point, racism and inequality have been major predictors on the ground in each of our communities. So one thing we've been doing over the last years, we've been working with a local African-American community to work on both resilience, if I can do that. That is, taking care of our own and figuring out our own problems, but also political pressure. But I think, to Paul's point, I don't think we're going to learn the lesson, which is we need to invest in our systems. So locally here in California, the governor has a $256 billion budget proposed, and public health asked for $200 million in funding, and he said no. I've given a lot of money to the hospitals. Well, for those of you who know anything about healthcare delivery, there's this enormous gap between public health and the hospitals. So giving money to the hospitals ain't going to help us be prepared even for the next flu season, right? So, that's my pessimistic response. But we can compare counties and states, et cetera, on their reactions, on their responses, and there were better and worse, so we've seen that there are lessons to be learned that are just very practical and in the weeds, even though I don't think we're going to solve the larger problem of preventing these enormous messes.
That's really interesting, Terry. And I'm just wondering if we could think also about what, how can we manage through these comparisons? What can we do to make them more speedy and to flesh them out and to actually think about responding to the differences, finding the variables that matter and addressing them? I mean, I think this is, I think in my mind, I think you're hinting at another performance standard, another performance variable, and I don't know what it would look like. You would know much better than me, but I'm wondering if we could take that further.
Sorry, I have to leave. I have to a meeting of the African American Response Circle.
Oh, so you don't. That's true. So you don't even have to bother. You're lucky.
So, but I'm gonna put a trivial blog in the chat just about lessons learned about long-term care facilities, which are cruise ships, and lessons learned for local public health departments.
Great.
So just in case you're interested in following up, and Paul, maybe we should talk. Gotta go. Thanks.
Thank you.
All right, thanks, Terry. There's a question from Lewis.
Hi. I think it's been very interesting, and I work on China and public health, more or less. But I'm from the UK. And I was working in WHO in China when COVID erupted and was there for all of last year, and now back in the UK. One of the very interesting things, I think, is about the ways in which systems get rebuilt after crises and the sort of rapidity of learning and assimilating lessons. I think we're seeing very rapid learning within China, and there are things within the way that sort of Chinese target setting and management approaches work within government that do recognise or do allow space for failure. I'm wondering, and I think we're kind of seeing in the UK a lot of failure, to be honest, in how the UK has managed the pandemic, but I don't think we're necessarily seeing the same sort of rapidity of learning processes. I'm wondering if there's are there any thoughts on how organizations or systems move towards being more operating more in the sense of being high reliability organizations, what those processes are like of going, not necessarily just the processes that are embedded within high reliability organizations, but the process of getting from whatever it is, bog standard sort of public service organization to one which recognizes the need for these kind of mechanisms and approaches and goes there, sort of the actual political and organizational process behind that.
Well, I have to confess that as somebody who's studied these organizations for a long time, I have no idea how an organization becomes a high reliability organization. We just go into one that is, there's people say that's a high reliability organization. So we look, and I don't know that we know, but I do think some of this would depend on better public support for the process of becoming a high reliability organization. I mean, some foundation of public and political support, because it costs a lot of money to do it. You can't, in a sense, you have to, efficiency is not going to be an important, you have to make some things, investments that are less efficient. Excess capacity has to happen, which a lot of people think is, all the people with MBAs who know excess capacity has to be stamped out. That becomes a harder thing to do. I mean, I think we could look carefully at what the precursor conditions would be to encourage this from happening. And one of the things I think would have to be, again, suspending the wrong performance assessment while they're trying to get more reliable, because it's going to be an up and down track to do it.
Thank you.
So I'm curious, Ellen, forgive me, were you the one at Amherst who was studying? Yeah. What are your thoughts on all this? It seems like it's in your wheelhouse.
It's actually not in my wheelhouse at all, because I, as a historian, even some of these terms that you're using are totally new for me, which is very interesting. I mean, I think that where I see the closest connection is in the comments about psychology and sort of, public responsiveness to measures and how tricky that is. I mean, I think that that's what I'm trying to get at historically, of how sort of emotional responses to risk or psychological frameworks that are applied in times of crisis have been historically created and therefore are very difficult to manage and shift in a very short period of time. But yeah, I wish I had more to offer. I'm just kind of hanging out here and enjoying the conversation.
It seems like, so Paul and Emery have talked a lot about dread and specifically with precluded events, right? So it sounds like, generating dread or mitigating dread is both organic and a tool. And who knows where we are in the process of dread with respect to COVID-19. It's not exactly clear to me, especially if we look across the different populations.
I think the China example is a very good example of dread. Is after Wuhan, it was quite clear the party felt a need to intervene and substantially dreaded the fact of reflecting the people's dread that this thing would get massively out of hand. I think the innovations will be, to stick with China, they have, some of you may know about the social credit system that they have. Well, it's not just dread of medical error being made with COVID. In fact, you could see a wider social sincerity about ensuring that COVID and other pandemics don't happen, and being used through different mechanisms, whatever we may think of these mechanisms. But within a China context, there are many ways to realize that dread, rather than just in the doctor's office or fear-mongering as a result of reports in one province or one large city.
Could I make a small kind of comment on that? Because I think something that's very interesting that we've seen over the cycles of China's reforms is this, there's a dynamic of centralization and decentralization and kind of some degree of liberalization versus control, and these things go in waves, and we've seen that over time, kind of forever really. I work with people who work on environmental governance issues in China, and I've done some work in that kind of area myself. But one of the things that's very interesting at the moment is the introduction of kind of lifetime responsibility contracts, effectively. So if you're mayor of somewhere and you screw something up, that will hang around your neck for the rest of your life. And it's interesting because it is in response to social demand for cleaner air, cleaner water, fewer mishaps and so forth. And it is through very particular and very punitive kind of systems that the central state or Communist Party can actually use. However, it kind of goes against another component of the sort of Chinese governance toolbox, which has been very important, which is that you can allow flexibility through sort of imprecise means of control, by kind of keeping an eye open and keeping an eye closed, if you like. and that kind of degree of tolerance of failure and that degree of ambiguity has actually been very important in the way that both in maintaining just general functioning in a very rapidly changing system, and also in providing space for generation of new kind of policy solutions and things like this, which, you know, China has historically effectively crowdsourced a lot of its kind of central government policy. So there's a very weird kind of dynamic there between the kind of tolerance that you need for those sort of approaches versus the kind of dread thing, and how dread actually can motivate improvement in systems.
Peter, you're muted.
You're muted.
Good. I was sorry.
I see
I was telling her
Ian
where the
and one other.
Peter, I see a hand
Kathy.
raised. I see a hand raised under K. I don't know who K
Yeah,
is.
that's Kathy Schaefer, if she'd like
And
to.
Ian.
Okay.
Hi, I have a quick question, or maybe not a quick question, but I wonder if some of the challenges are kind of related to the fact that maybe some of the solutions aren't particularly sexy, and that you just mentioned the idea that public, Peter, you were talking about the funding given directly to the hospitals as opposed to public health. You know, giving money to a hospital is kind of a, you know, you can stand with a ribbon cutting and, you know, you can be the governor and think of those. And I'm thinking about the natural disaster risk of fire. We know that, or there's been some talk that the real answer to some of our fire risk is really getting people to do their home hardening and to take the individual measures. And yet we don't really put an emphasis on that. We put an emphasis on buying big new planes and having macho firemen protect us. And I just wonder if maybe part of the solution might be finding a way to make these kind of bread and butter kind of everyday things that you really should do, make them more attractive, but I don't know how. I mean, and then the second question would be, if you did subscribe to that, what kinds of things could we do to make them more appealing or salient? And I don't know if I'm expressing that very well, but I'm curious what you think about that, Peter or Paul.
I think that that's really a great idea, and I don't know how to do it, but it is a good idea.
I mean, the issue comes back to what extent is the individual the sharp end, if you take the hospital medical, the sharp end of the needle, the reliability manager in a broad system. For some of these organizations we're talking about, he or she is not his or her own reliability manager. For some of the systems we're also thinking about, he or she has to be part of that network of reliability managers. So that is a core question, Kathy, that really does deserve a lot of serious looking at, particularly when the people, I mean, the first rule of policy analysis is he or she who gathers the information, if they use it, is the most policy relevant. So gathers are the users. So in fact, the reliability manager, if it includes the sharp end right down to the person, then that becomes a very different kind of reliability managing than what we've been describing.
Thank you.
Yeah. So I'll just say one more thing, that Carlene and I wrote an article on this broadly, and one of the things was, you know, we talk about patient-centeredness and or focusing on the patient in healthcare, but to what extent is the patient actually part of the system?
Yeah.
And if we're going to move the boundary of the system, how does that change our management of reliability? So I don't, we propose some things, but it's obviously a difficult question when it comes down to people's individual habits for mask wearing and vaccine use and so forth. Let me, Stian, if you'd hold on one second. Anne, it's good to see you. And also Anne has written quite a lot about pandemics and SARS and Ebola and so forth. So she had a point on this.
So first, apologies for joining late. I didn't get the link actually to join until just a few minutes before I was able to join. And since I missed many of the early conversation, forgive me if this has already been touched on, but Kathy, one of the things that when you give the example of money going to hospitals versus public health, or money going to, buying big intervention strategies sort of once a fire has started versus people hardening their homes, I think that there's a sort of a classic problem that prevention is invisible. When prevention works, you don't know it's worked. And I think, just to give an example, the United States has spent a lot of money trying to reduce the incidence of hospital-acquired infection, which is a really that's a way that people experience a lot of morbidity and even mortality. But if you go to the hospital and you come out, or your loved ones go to the hospital and come out and never get a hospital-acquired infection, you don't know who's active for you. And that's very different from getting cancer and then having people treat you and cure you for cancer, where I think that let people get sick and then heroically intervene is something it's much easier to sort of tie those threads. And so I think we don't even, when we look at kind of the way that groups politically mobilize for goods from the state, it's very hard to get people to mobilize around prevention. So I don't know that doesn't necessarily say that then how do we do that? And I don't think that we have very good ways of saying, look, in this county, we really put all this money into people hardening their homes, and look how much better these counties fared during the fire that occurred there. I mean, I don't know that those stories are necessarily all that persuasive, but I do think it's sort of a perennial problem for public health. When public health works, nobody gets sick. So nobody knows it's just a very different mode. And I think the same thing can happen kind of in fire with that example. I'm just kind of draw out that invisibility problem. It's there, and you've got to figure out how to get around it.
Thank you.
Thanks. So let's go to Stian next. Go ahead.
Unless Louis had a comment to Anne's. Oh, okay. I'm returning to your key question from the presentation. What does a term like reliability mean when faced with this kind of problem? And I'm thinking that perhaps it means something after all, because returning to the dread factor, I think the dread factor arises as a result of some form of a collapse of control. If you expect the whole world to be one giant HRO, you are bound to be somewhat disappointed. But nevertheless, Paul, you mentioned the term excess capacity. And there are some quite simple questions of excess capacity one might ask related to reliability. Masks, protective equipment, pretty basic resources to adapt to also this kind of problem. Of course, with their own sort of challenges once everyone wants to buy the same masks at the same time, but that we shouldn't throw our key concepts overboard. And I'm sure that's not your point either, but there might be something here, and trying to find that balance, what is relevant with the core of our key notions, and what do we have to refine or leave behind?
Yeah, I agree that the issue of excess capacity and the issue that Anne raised about prevention not calling attention to itself are major things. I mean, how do you know the value of something that didn't happen, or the disvalue of something that didn't happen? And that leads to all kinds of behaviors, underinvesting in maintenance in companies, for example, and technical things. Because it's hard to know a return, and nobody makes a big career in business by things that didn't happen. So, it's a problem. That's in a sense where dread comes in. You can have excess capacity. People are scared to death of something happening, and they're willing to spend whatever it takes. And it's the same thing, with respect to infectious disease. Part of the problem with healthcare is that the accidents are singular and not masses of people at once. I mean, in terms of hospitals, for example, if people were worried about it sucking them into a massive risk, that dread is much better for them to support. Oh yes, prevention, absolutely. As many dollars as you need for prevention, we're ready to spend it, or more willing to spend it. That's different. And so I think I don't know. Short of dread, I'm not sure of the kinds of mechanisms or accounting processes that will give equal weight to so-called excess capacity and prevention to the ongoing operational sort of outputs that people can see and measure every day, or the heroic things that happen. I mean, maybe you could tell more stories about heroism on the prevention side, things that people did, precursor reliability events that took place or something. But I think it's a much harder process. I don't say it's impossible. We should think more carefully about it.
Just one quick reply. In Scandinavia, there are a lot of eyes turned to Finland, because for some reason Finland had this huge storage of equipment, while everyone else were sort of attacked by the army of MBAs aiming for just-in-time production. Let's streamline, let's move all excess capacity. The Finns did the opposite. And why did the Finns do the opposite? This is only speculation, but I guess one hypothesis could be that they have sort of a memory of a different kind of dread, being a neighbor to Russia, meaning that there might be a need to be prepared for something that might never happen, but that gaining a sort of legitimacy for some strategies which make absolutely no sense in other contexts, but which might make perfect sense in Finland. I'm not trying to make the discussion about Finland, but there are some very interesting variations here.
Right. Actually, I can't resist, while she's still, Tonya is still here, I sent an email to her suggesting, I noted that the death rate from COVID in Norway was so low. And so I speculated, perhaps you Norwegians are unusually healthy people. And she wrote back and she said, when it comes to the unequal spread of the pandemic, my guess is that Norwegians are natural talents when it comes to social distancing. And that for once it was a good thing.
I concur.
That's very cool. John, you had your hand up.
Yeah, I did. I mean, I don't want to be pessimistic about this either, but there are some worrisome strains in society at large, maybe more so in America than many other places, but the kind of selfishness of our leadership, that's been much of it that's been revealed, the willingness to sort of pass responsibility off or blame others for one's own failings. This kind of, if we just tell our public enough times that it wasn't our fault and that there are other evil people out there, it's all their fault. And it really is debilitating in preventing real facts from getting around and real successes from being told. And in addition, there's a significant minority of people who want this to happen. There are the surveys show that there's not that they want a pandemic per se, but they believe the end of the world is coming and coming soon, and it's a good thing because the righteous will be saved and everybody else will be lost, and that's good. So this is God's finger on the scales in their favor somehow, and this is it's not a lunatic fringe. It's a quarter of the adult population in America.
And you said you didn't want to be pessimistic?
Of people out there who kind of think that responsibility for this rests outside of us. It has to do with science. It has to do with large-scale reaccounting of how society is running, and that bothers me a great deal. And it's very hard to mobilize broadly when you have so much disinformation and so much almost willful reinterpretation of everything that's going on around us. So I think we are systemic problems, and that these are highly interlinked, and in a way a pandemic, which is almost a biblical event. A pandemic allows people to say it's those who are weak or who are evil who are being afflicted with this, whereas the righteous are going to survive it. And we got to get some. I don't know what. The only thing I can think of to do to get past that has to do with credible leaders, and at the same time we've had so few really credible leaders stepping up in this moment. So I end up being I'm a little depressed at the moment. I'm sorry.
Right. Now, John, thank you for now. We're all depressed. But let me just say one thing. I agree with everything you say, except for one thing you said. Well, the problem is we have leaders who say it's not my fault and they blame somebody else and it's their fault. If Emery and my approach took place, people would say the problem right away is your use of the term fault.
Yeah.
If people couldn't get away with faulting others, that, it seems to me, might be at least some kind of starting point for trying to assess more realistically what the actual variables are in play.
Yeah. But on the other hand, the rhetoric in the media is all about fault.
Absolutely. There wouldn't be a media. Right. How can you have a newspaper without somebody being at fault to portray? I mean, it'd be tough.
So I really wish we could get past that. And there were some good signs a couple of decades ago, but we seem to have swung the pendulum back in the wrong direction. And I hope we can swing it back the other way.
So that's John's case is, unfortunately true and also depressing, but also extreme. I think one of the challenges that you didn't directly address is that a sizable proportion of people, even at the policy level early on, were saying we're trying to promote herd immunity as a solution. And that, no, we should in fact be spreading it. We should have, chicken pox party and share it with each other. And those two things are both in the same ballpark of people that are just taking the opposite view and taking it seriously, and people in positions of power to legitimize it. So I'm just wondering, Paul, Emery, like what your take on that is in the framework you presented.
I would like to hear the other people who have their hands up first. I'll retain my comments to the end.
Sure. Okay, well, we'll go in order then. So Louis.
Thanks. A couple of things sort of kind of responding to other interventions and comments. The answer was about the difficulty of maintaining public attention on things that you don't see. For a few years, I've been working on some project related to antimicrobial resistance and the development of new drugs for this. And it's amazing how little we really invest and how little anybody really seriously pays attention to this, despite the fact that it has potential to derail all sorts of systems that we rely on. And it's something that hangs around in the background. We, collectively know it's a threat that's out there, but it's very hard to really focus attention on that. And I think a lot about China. If you wanted to really get China to get on this bandwagon, well, what would you do? You'd point out the difference between hospital-acquired infections in China and in Japan. You know, is a kind of, I think, you know, and suddenly the Chinese government would actually really have to sit up, because the middle classes would turn around and go, well, what the hell are you doing? I mean, why are you not keeping us as safe as our, you know, as people in Japan? And I kind of wonder how we mobilize these sorts of, I don't know, it's not quite, I don't know, dread is maybe the word, but it's also sort of, to some degree, kind of be actually politically savvy about how you mobilize these arguments to really create change. And that was one. And I think, I mean, in thinking about sort of what, I mean, this word dread has been coming up, but I sort of suspect there's a kind of continuum through from at a sort of policy level, kind of agenda setting as a way of describing the sorts of things that we're thinking about. An organizational level, I don't really know, but I mean, how do organizations get onto this kind of track? And then at a public level, you've got the similar kind of processes of kind of which are mostly framed around psychology and these issues. And I think weirdly also there's a kind of question of scale about how you draw the boundaries around your system, because in terms of redundancy, you know, the Chinese government sent about 40 or 50,000 people to Wuhan to provide emergency support. And there's pretty much nowhere in the world, I think, that can really just mobilize that number of people, you know, at a moment's notice, more or less. But, you know, you've got a very, very large system with a degree of spare capacity, which under most circumstances is not actually spare capacity, but is suddenly freed up by the emergency that you're going through, because it's so, it's very geographically concentrated. And suddenly you can really ship in tens of thousands of people. So, I mean, those are some thoughts in response to these things. I think, I mean, these are very weird issues. I don't quite get how it all hangs together yet, but these are very interesting thought processes to be going through. Thank you.
Comments?
Anne, what's Anne? And
all right.
So I was going to reply a little bit to what John said. Louis, just what you're raising, I think, is really quite interesting to think about. You know, what is it? Who can sort of mobilize, and at what level can people mobilize during pandemics? It's really, you know, it's trying to plan for responses that are. I mean, I think sometimes we think of pandemics as sort of, you look at maps in the New York Times or whatever, it's like all of the United States is red, you know, because or you know, purple, because we've got so much transmission. But when you start to actually look at the transmission, it actually was quite, in every sort of month, it was quite concentrated in a handful of areas. And that led us to, I think, a really, for me, a particularly poignant moment. I grew up in New Mexico, which is not the most wealthy state in the country. In fact, it's one of the poorest. And at a certain point in the pandemic in the US, New Mexico was taking cases from both Arizona and the much, much, much wealthier Texas, and providing hospital beds to their neighboring, much richer states. Because New Mexico had just frankly managed the pandemic better, and they had excess ICU capacity where Arizona and Texas lacked it. So sometimes you even get surprise kind of excess capacity, even from a poor state like New Mexico, which is just an aside. I was going to try to inject maybe, I don't know if this is like a wee bit of hope in what's looking like this era with social media where people can kind of construct their own realities. But one of the things that I wonder, and this is just a hypothesis, is that when I think about the way people form kind of political identities and cultural identities, and this isn't my area of specialty, so I'm going out a bit on a limb, but we see cohort effects where people, you know, people who sort of came of age during Watergate felt, you know, they mistrusted government, and at that stage, I think they tended to, there was sort of a surge in kind of democratic partisan democratic identification. And I wonder what's going to happen in America. And I think this could, you know, we can ask this question more broadly in other countries, you know, this may be playing out as well, depending on who is in power. But in the United States, we had, you know, sort of two pandemics. We had the pandemic where Trump was in power and saying it wasn't a big deal, and sort of and not kind of creating a national response. And then we had Biden take office and really hit the ground running with vaccination. And I wonder what do people who are sort of early in their political participation, early voters, young Americans, what do they take away from this? And it's, I don't think it's necessarily clear, but the potential is that they would be, relative to, say, their parents or their grandparents, they may be more invested in the public sector. They may be more interested in how vaccination, where it comes from, where do the investments that led to the vaccination, to so many vaccines being so effective. They may be more open to the idea that public-private, partnerships, that the government working together with, for example, brick and mortar pharmacies, were really effective at sort of rolling out vaccination in the United States. So I think that, there are many other lessons one could learn. For example, if you are experiencing the pandemic in the rural United States, you may be in a county where very little public health got done, and where in fact there is some measure of herd immunity because people weren't wearing masks and they're not getting vaccinated. And so you could learn the opposite. You could learn that what we should do is do nothing because, the population at large kind of survives and is able to sort of resist, and I haven't seen enough epidemiological data to say that that's actually happening. But I think there's the potential for interesting kind of cohort lessons that people might carry forward with them. And I do think this pandemic, at least in the United States, is going to massively shape what young Americans think of both parties going forward. So I guess that doesn't quite say like we should inject some optimism, but there's the potential there that this transition between the Trump administration and the Biden administration is sort of showcasing what the federal government can do, or even state and local governments can do in a way that's relatively new.
Thanks, Sam. Yeah, I guess so. You see, I think at least from the younger students I've run into, they seem to have some faith in institutions more so than slightly older cohort. So, Natalia.
Let me just say quickly that faith in institutions doesn't mean that uncertainty, speed, complexity, scale go away.
Mm-hmm.
They don't.
Sure. Natalia.
Thank you. First of all, Paul, Emery, thank you very much for a very thought-provoking presentation. And certainly there were a lot of very interesting questions raised. I find the discussion around how to mobilize attention around the need for prevention and positive change very interesting. And I look at it with a communications lens. We like to say that the plane landed is not really a story. The plane crashed is a story, and our attention tends to chase the latest bad news story, which seems to be feeding the cycle of political decisions, public mobilization, and ultimately funding. And there are so many dreads that compete for the piece of the pie in this zero-sum game. Every disease group right now is arguing that it needs to get its fair share of funding. It's not just all COVID. There are neglected tropical diseases that have been severely underfunded over the last 14 months. AIDS in Africa, which is again on the rise, diabetes epidemic in Canada. And there are all the decisions to be made, and nobody has a crystal ball. Canadian government is trying to figure out how much needs to be invested in COVID versus flu, and there is big investment going in flu and other disease groups. And again, because there was no bad news kind of pressure on the pandemic in the 2 years preceding COVID. Unfortunately, in Canada, we had a situation where we didn't have enough masks. Some of the supply centers were cut 8 months before the pandemic. We had a very sophisticated virus surveillance program in Canada. It was also eliminated 2 years before the pandemic. And we had a long-term care disaster, and there was no mechanism to deliver vaccines at the community level. So all of these things are lessons learned, and certainly we are in the post-mortem phase right now, which started to happen going into the first anniversary of the pandemic. And it's very interesting what's going to change as a result of it. Right now, I think what we see is that WHO continues to be severely underfunded, which seems to be one body that could bring a lot of the, at least exchange of thinking and best practices to one place. So it's a bit of a take on it from a communications perspective, I guess.
Thanks.
Yes, thank you, Natalia. Before moving to Stian, if you could hold on 1 second, let me just give an opportunity to Gudve and Tona and anyone else who hasn't had a chance to jump in, if you'd like to. Or glad to listen for the moment. Okay. All right. Tona, okay. Go right ahead.
Yeah, okay, I'll grab the opportunity. I think part of the problem here is it's difficult to assess something that is still going on, because I have a history background myself, and I think it's easier to assess something which has occurred than something that we're in the middle of. But having said so, Paul, in the very beginning of the presentation, you said that, or you asked the question, what performance can we reasonably expect? And I think that's part of the clue here, that maybe more than rethinking reliability, we have to rethink our expectations towards the public services. And that when we talk about excess capacity, we also have to accept that there are limits to this capacity simply because of the costs of them. So that would be very nice to hear your thoughts on afterwards.
Yeah. I agree with, I think that's a very good point. And I think where we are is a situation where the condemnatory reflex is so sharp and so institutionalized across media, politics, that it's much sharper than the tolerance for understanding what reasonable performance might actually mean. Because many people are in situations where they don't have to worry about what reasonable performance would mean in order to condemn what they've seen so far. And so I don't know how you need to turn down the volume of one and turn up the volume of another. I'm not exactly sure how, but I do think, and here's where I think there really is a possibility. People in our field who do recognize the difficulty of condemning relative to, or the ease of condemning relative to the difficulty of understanding what the reasonable performance would be, need to speak up more and say that you cannot just say, this is your fault. You cannot just condemn and impose accountability without actually understanding that question. What would a reasonable amount, and even debating that question, how many deaths? We don't know how many deaths is a precluded event, but we could figure out, what are the background numbers, and when can we begin to say something about we need to do much better than this and think about what investments we should make to do it. I mean, I guess I'm not being as clear as I'd like, but I think some way in which there could be a lobby for reasonableness, not only reasonableness in analytically speaking, but reasonableness in behavior. That would be very helpful.
If I could come in with several comments addressed to this latest question as well as earlier one, but to extend what Paul is saying, to recast it, okay? Yes, there's far too much about blame, but really what's going on is valorizing the cross-sectional analysis for a problem that is by definitional longitudinal. We're sitting here thinking, oh my God, masks really work, you know, or wasn't it great that New Mexico opened its hospitals through Texas? Okay, well, that looks like a tragedy of the commons, prisoner dilemma problem. It may be later on we see that all that did was reinforce Texas bad healthcare. Once you add time dimension to these problems, what looks like a success story, masks and opening hospitals and local behavior, comes into question. Okay, as we saw with, oh, look at what Sweden is doing early on. Oh God, look what Taiwan was doing, success story later on, second surge, third surge, not such a success story, okay? So what I think personally, what the message I was hoping to get across today is the conceptual challenge is a problem that is at the limits of known complexity, known uncertainty, known speed propagation, and global. Okay, again, I would be the first to say there are elements within it that may be high reliability, maybe R&D that we're looking for, and so on. But at the limits would force you into a longitudinal assessment. You are by definition have to wait before you assume all the masks were all the good. Okay, we're not there yet, even though cross-sectionally at this point in time, it looks okay. And that leads me to the second, the practical implication. The conceptual is the nature of this problem. Conceptual is I write about mess. Believe me, folks, this is not a mess. Okay, this isn't a mega mess. It isn't a mega crisis. It's something different. It is something that is, once you take out the less complex, the more HR, the high reliability and R&D and so on. Once you take that out, this is at the limits of what we know for management and for policymaking. Now, what is the practical implications? The practical implications is, as you said, we tried to say, what if we can't use reliable, if we can only use reliable and effective and resilient cross-sectionally? We can't use it comparatively. We can't use it longitudinally. We can only use it by saying, well, this looks more resilient at this time. Okay. And as organization theorists and people who are thinking about broader issues, it's incumbent on us, I think, to drag in the time perspective in this way, even though it is full of unknown unknowns. We just can't second guess. And that leads me to the final one. While I was talking about these bigger issues of inequality and justice and global climate change, I happen to believe those are the real issues. Okay, we do need to see and have better understanding how those factors affected it. But I want to say that the research will probably show it affected it differentially, site by site. Okay, and that is where I hope we end up. Out of the blame game. Currently, the blame game is the only point of stasis we can use to move this thing forward. To blame somebody and say, oh, we need more masks. Oh, we need to be more like Taiwan. No, actually, we need to be more like Taiwan first time around, not second time around. Okay. This blame game is is a weak read in the face of all that we don't know and need to know and understand just what is this? If it isn't a crisis where we can, in the old term crisis, we could at least refer to recovery and an establishment of a new normal. Pray tell me, folks, what is recovery and what is the new normal? This is why the pandemic is so different and why other problems like the pandemic are so different.
All right, to follow that up, so we have about 15 minutes left of the structured presentation here, and a few hands up. So we'll go back to Stian if you'd like to ask your question that you've been holding for a moment.
Yeah, I think I'm actually follow up on Emery. I suspect it's the same argument, but it's like an hypothesis. If we did this longitudinal study 5-10 years ahead in time, looking back on the pandemic, asking what were the key variables explaining the differences in performance and management. And I think, at least it's some hypothesis, that the variables we would find were really context dependent.
Yes.
So I guess there will be different variables in play in the US, in Finland, or in Norway. And in a demanding situation like a pandemic, you're going to be haunted by whatever policy or management problem you had going into the pandemic. So the US story will be a Trump story, but that is obviously irrelevant for Finland's internal, hopefully Finland's internal way of dealing with it. So this is like more into the variables that Emery mentioned, these very deep societal, cultural traits. So the strengths you have and the weaknesses you have are sort of magnified by a problem of this scale.
Right, thank you. Dave, you there?
Yeah, I'm here.
Okay, you had your hand up. Are you?
Yeah.
Okay,
Thank you, Peter. Yeah, I had to leave for a little while and then come back again. Everything froze up for a moment. But in any case, I'd like to go back to something that Kathy had mentioned earlier about looking at wildfires, since that's an area I'm a little bit familiar with, and trying to learn from our experiences there in managing incidents that may seem similar, but are oftentimes, almost all the time, very different one from another. And so they have that uniqueness and that ambiguity and the volatility and the dynamic complexity situation. And there are things that we in the wildland fire community tried to learn from things like writings by Wyke and Sutcliffe, Managing the Unexpected, and then working with people that were trying to build learning organizations, and eventually focusing on shifting our premise, our ways of seeking accountability and redefining that as more looking at responsibility. And accountability is an ability to tell your story instead of trying to balance somehow accounts and seek retribution. The refocus then, the reframing, changed from name, blame, shame to learning. And this is the HRO thing that we really tried to key on, the continuous improvement, the adaptation, Eric Holnagel's way of looking at resilience as not bouncing back per se to a previous condition, but more of flexibility and adaptability and being able to change our thinking and our processes before, during, and after events. So their continuous improvement could actually be something that would lead then towards reasonable approaches, reasonable conversation and thinking instead of the highly emotional finger pointing and seeking out safety through finding somebody to say, put his head on a spike and our problems are solved, you know? So I think that this shift in the human condition is something that is worth pursuing, and we're finding it in the way that we build teams and crew cohesion and the ways that we help people to work well together. Those fundamentals can travel from relationships between diodes, people, pairs, to teams, to communities. And this is, I think, getting back to more of a fundamental approach to how to prepare and then how to respond. And as organizations and be personally, individually responsible in taking care of yourself, your situation, but also your neighbors as well. You got all that, Peter. I'm glad that you are shaking your head up and down, and I see I have a convert here already. So this is perfect. Thank you.
Okay, well, thanks, Dave. And our last hand up is Anne, and I'm very curious for your thoughts on this. There's a lot of work on previous communicable diseases.
Well, I mean, one of the things I think immediately, just sort of responding to what Emery laid out, is that I think it's incredibly, and I think actually a number of you, Stian made this point as well, that events in some senses are so unique. And I have a chapter that I wrote that sort of trying to address this, how do we learn lessons from these events that are just incredibly specific and unique. And it's certainly true that people spend a lot of time doing it. There are these huge lessons learned literature every time there's a crisis, and I think we'll probably be writing about this for decades. But I think it's there is a problem both in terms of longitudinal and sort of comparative analysis of really trying to learn from cases that are quite unique, which doesn't mean that I think the professional class of people that manage these things aren't trying to do that all the time. They are certainly, I think there's a period of, there's internal learning during a crisis where you sort of try to get your footing. And I think there we tend to see very fluid response as people are sort of learning what this crisis is like, and unlearning the lessons from the last crisis in some senses. And then we begin to see professionals sort of get their footing. That doesn't necessarily mean that everything is going to go smoothly, but I think there are ways where you can see a lot of missteps early on as people are learning kind of what are the contingencies, what are the surprises of this particular instance. And I think, in some of my writing, what I've tried to focus on is that we oftentimes act as if discovering the infection is the hard part. And I think the hard part is early response. I mean, obviously you can't respond if you don't see transmission. But I think that we see a lot of missteps once we think we know what we're dealing with. And I was thinking too about just, how much we're sort of talking about the blame game. And I learned something very interesting when I was doing field work, trying to learn about the 2014 Ebola crisis in West Africa. And in the media, there was a lot of finger pointing and blame about how poorly that was managed in the US. And how slow the international community was to respond to what was happening in West Africa. And I was able to interview people who were part of the CDC effort. And I thought that they would tell a story of that. I thought their stories would match that they would talk about failure. And they didn't, that wasn't the story that I heard from them, which isn't to say that they weren't critical of missteps, but there seemed to me to be sort of an insulation. They didn't internalize kind of a media story about failure. And they had a sense of accomplishment, and they had a sense that they had made a difference. They didn't do it immediately. And there was this long period between, I think, April of the discovery of Ebola in West Africa and sort of the August through September response. There's a long period of flailing there that I think most people would recognize. But the longer story was one of accomplishment. And so I think it's an interesting thing to see, that there's not just the media narrative. There's the professionals who are trying to learn and trying to improve response, have their own kind of internal understanding of where they did well and where they made missteps.
Maybe just a quick reaction to that, because I think that's a really good point. Maybe one of the things that's really interesting and perplexing about this is that there is no homogeneity across the scales, so that the lessons learned in one place by one set of people and the perspectives gained by them won't be, there is no single model of performance that applies down through the levels. And it's a mistake to try to think about performance variables across the levels of scale. One of the confusions is there's no composition rule. The small things don't add up to the big things. And that's part of maybe we have to rethink our whole approach to assessment on that idea. There is no single assessment that's valid across the scales.
So if I may, let me just show your slide again here, the sort of special learning. So there are any final comments on these based on our conversation today?
Paul, you have the last word.
I guess that hypothesis is right.
Can't ask for more than that. Great. All right. Well, so we're reaching our usual endpoint. So if there are any other burning comments, none, then thank you all for joining another CCRM meeting. I think this is our last one before the summer. Maybe we can squeeze another one in, but otherwise, we've already gotten some things on the calendar for the fall, and a new website that's coming together, which will have all that information on it. So you can look for emails about that over the summer. So
Emery and I would also like to thank everybody who came and had the right. They're very helpful, and my thinking's already morphed from those comments that I heard from everybody. Thank you.
Thank you.
All right. So thanks a lot, everyone, and we'll see you next time.
Thank you, everyone.
Thanks. Bye.
Bye-bye.
All right, Rune. So I think everyone is off now, so we can, if you're still there, you can